DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm excited about today's show. We have Dr. Mike Apley back with us to talk about antibiotics in cattle. We're going to talk about a lot of things for spectrum of activity, concentration versus duration dependent, why we give one shot, and much more. Thanks for joining us here on DocTalk, and we'll see you right after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome to DocTalk. Mike, welcome to the show.
Thanks.
It's always good to have you folks. We have Dr. Mike Apley, who is a professor here at the College of Veterinary Medicine. You have a new title.
Yeah.
You know,
Frick Professor.
You're the Frick Professor, and you want to be careful how you say Frick when you say the professor.
Exactly.
But anyway, Dr. Apley, it is an honor to get a professorship. It's due to your work that you've done nationally and internationally in the world of food animal pharmacology. And I know we joke around a lot on the show and things that we do teaching together here, but you're one of those people that's been a mentor for me and a mentor for a lot of people, and we're going to talk about that subject of antibiotics, which is not going to get to be a smaller subject, is it?
No, and it's getting bigger and bigger. So, the last time we did this, we talked about some basics about the drug groups and which groups are what. So today, thought we'd continue on with some more of the basics about how these things work and what's behind the recommendations a producer get from their veterinarian.
Well, let's just start out with the term spectrum of activity, and kind of what is that?
Spectrum of activity includes the bacteria we expect an antibiotic to be able to be effective against. Okay. And being effective against doesn't necessarily mean killing it. It can mean just slowing the growth down enough that the body gets on top of it. So it's very important to remember that antibiotics help cure the animal. They don't do all the work.
Right. They give the animal an opportunity to cure itself. Mm-hmm. So let's go down through, because we had some topics that we're going to talk about, and we get into like bovine respiratory disease. And you can have narrow spectrum, broad spectrum, and when they're narrow, that means it's going after a single class or a general class, and broad is many classes, right?
Yeah, one of my favorite questions for the high-level pharmacologist is just explain exactly what narrow and broad spectrum means to me. I knew it best when I got out of my PhD, and it's become less clear to me as I've gone through practice. But really, for narrow spectrum, the thought is it either gets primarily groups we call gram-positive or gram-negative, which is based on how the cell wall stains. And so that separates them into two different groups with a lot of different characteristics. So it's kind of a loose term. But for respiratory disease, we've got quite a few labeled drugs that have the primary respiratory pathogens within their spectrum. One of the ones that falls in and out of different antibiotics of their spectrum is Mycoplasma bovis. And one of the reasons is it doesn't have a cell wall like the others do. And so drugs which require a cell wall to function on, it won't work. It won't work. So, the veterinarians can help if you're having a Mycoplasma bovis problem in a group of cattle, why there's some antibiotics that you'd pick over others because of that.
What about foot rot?
Foot rot is an interesting problem. The pathogen, the bacteria that causes the disease, likes to live without oxygen, so it's called an anaerobe. And we have some drugs that work well with anaerobes and some that don't. So it's a matter, but foot rot, if you catch it early, it's really, really responsive. We make a big difference in all of them. Now, if they've got that club foot and they're already swelling up and it's hard, I think everyone listening knows it's had one of those, it's not going to work very well. But we have a lot of drugs that work well in that activity or for that site.
Cool. Well, I know we want to talk about pink eye, but we need to go take a break. When we come back, we'll talk more about antibiotics with Dr. Mike Apley. You're watching DocTalk, and we're glad you joined us.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Emily Sievert was raised in a small farming community in western Ohio and is a fourth-year student at the Ohio State University College of Veterinary Medicine. She studied bovine respiratory disease in beef feedlots and was also involved in a related telemedicine project. Upon graduation, Emily plans to focus on food animal medicine, pathology, and food safety.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of NRoblox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Mike Apley, who is the Frick Professor here at Kansas State University's College of Veterinary Medicine, and he is a boarded clinical pharmacologist. And Mike, when we left, we'd already talked about BRD and foot rot. Let's talk a little bit about spectrum or types of antibiotics you pick for pink eye.
The thing about pink eye that a lot of our listeners may have seen is seeing the vet put a shot of an antibiotic up under the eyelid. And actually, some of our newer research casts doubt on exactly how effective that is. Probably a lot of the good is from draining out from that injection site over the eye, with penicillin. But there are others that are labeled for pink eye that have systemic administration where you give them under the skin. And the thing to remember about any drug, and especially antibiotics, is it goes everywhere in the body. So it's not necessarily better to put the drug right above the eye or at the eye. For pink eye, you can get really good treatment response, studies have shown, by putting something systemically, just like you would for foot rot or respiratory disease.
I can still remember having tonsillitis or strep throat as a kid, and they'd give you the shot of penicillin. They didn't necessarily put it in your throat.
No.
So, all right, well, let's get on, because there's some of the things I want to get to, like the term, I hear this all the time, concentration versus duration dependent drugs.
So concentration dependent means that the drug is most effective when it gets a quick high peak and then it can leave. And you can still wait a long time for the animal to respond after it leaves, but the effect on the pathogen happened from a very, very high concentration. So drugs they'd know by the trade names Baytril or Advocin, which are fluoroquinolones, those are peak dependent. They're really dependent on concentration. Then we have other drugs they'd know as LA200, liquamycin, those drugs, biomycin, all the long-acting oxytetracyclines. And those work by having a long time in the plasma or the serum, the part of the blood that's liquid, a long time that is above the concentration it takes to inhibit that organism. They don't necessarily have to kill it, they just hold it down.
So some of them, and that's the reason why you can retreat at 48 hours with some and versus 10 days with others, is whether or not they're concentration dependent, which you put in there and you get a big dose. So here's the thing. I see people say, well, I'm going to take a concentration dependent drug, and you use Baytril and Advocin as examples of those. Given those at lower doses over multiple days would probably not be as effective as a high dose once.
Yeah, I was involved in the initial work for one of those where they had it initially we're going to go as the label as giving it multiple days, and the first time they said, well, instead of doing that, we're going to give it all on one day and then watch to see what happened. And I was nervous too, and sure enough, it works just as well, if not better. But it's essentially the same results from doing it once. And so we've got drugs out there. Some of them are dependent on a slow, prolonged release, and some one big hit.
Okay. Well, that's concentration versus dependent. We're going to take a break. When we come back after the messages, we're going to talk about why you can give one shot and then wait until the animal gets better. Thanks for watching DocTalk. More with Dr. Mike Apley right after these messages.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Working your cattle just got easier. Introducing the new Vet Gun delivery system, a new way to apply topical insecticides to your cattle. The Vet Gun lets you remotely treat cattle with effective parasite control, so you can do it from an ATV, on horseback, or just walking among the herd. It's that simple. The proven topical insecticide AML Vet Cap is used with the Vet Gun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. Vet Gun. Check with your animal health supplier for availability.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook. Specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle, Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd. TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Mike Apley, who's the Frick Professor at the College of Veterinary Medicine at Kansas State University, where he serves not only as a veterinarian and a professor, but he's also a boarded clinical pharmacologist that is internationally renowned and speaks at many different venues for producers, for veterinarians, for dietitians. People want to know more about food. And Mike, we're going to talk a little bit more about the antibiotics. And we've got this segment titled One Shot. So why can we just give one shot?
There's two reasons. One is, some drugs last a long time, give better coverage, longer coverage. Some, like we just talked about, work with one big thump. But even after that one big thump on the bacteria, you could clear the body, but that animal isn't going to look better right away. So, everyone listening has had the flu. And even when the flu virus is beat and you can go back to work, the really severe signs have stopped. But still, when you go back to work, you're not ready to go out and run 2 miles, or you feel punk for a few days. So one of the things that long duration antibiotics did for us, I think, is give us the courage to wait a little longer and allow those animals to respond. And as more and more research data comes out, probably for a lot of these drugs, no matter how they work, giving a little more time for that animal to respond is a good thing. And so we look for respiratory disease 5 to 7 days for a lot of drugs, and everyone should talk with their veterinarian on how they feel about what we call the post-treatment interval and how you deal with animals during that interval that maybe look especially tough. But one of the things I think we've really come a long ways on in the last 5 to 10 years is understanding that giving them some time to respond can help the animals have a better response rate and also stop us from maybe giving more antibiotics than are really needed.
Yeah, and I keep using the example that if you're sick and the doctor says you can be treated once and go away for a week, or I'm going to treat you 3 days, Monday, Wednesday, Friday, and the case fatality rate doesn't improve, which treatment do you want?
Yeah, I'd like the single.
Just one.
And it wasn't that long ago that we were introduced to the first drugs that allowed us to do that, because long-acting oxytetracycline came around like 80, around 80, and then we got the first other one was tilmycosin, which we know is Micotil. That was 92.
Yep.
So when those came out where you could give one shot and then wait 48 to 72 hours, it was really tough for people because they felt like, well, we got to get them in the chute the next day, at least to touch them. And so we continue to evolve along that.
And so we got about a minute. So one of the things that while we're on this topic, because, what happens when you give 2 drugs at once? Or what can happen? What can be some of the negative consequences?
In some cases, at least theoretically, they can interfere with the activity. Some need the bacteria to be rapidly growing, and some slow down the growth. There are cases where it's been documented that 2 together help, but before I put 2 together, I want to have documentation that they actually help. So more isn't always better with antibiotics, and if I don't know different, I always go with just one.
Yeah, I never recommend 2. We're going to take a break here, and when we come back from the break, we'll wrap up with antibiotics, and we're going to talk about root, volume, needle, all that type of stuff on making your treatments effective. You're watching DocTalk. We'll see you here after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
I'm Ron Gill. I'm here with the BQA Tip of the Day. I'm going to look at beef quality assurance from a total management package. And quality assurance programs have to encompass everything that will impact the safety or quality of the beef produced on your operation. That means any production practice, any management practice, any animal health practices, and certainly the livestock handling component will impact the quality and the safety of the beef. We focus on stockmanship quite a bit because it impacts how all the other management practices are expressed. If cattle are calm when we process them, they will respond better to vaccines. They respond better to vaccines, we have less animal health issues that we have to treat with antibiotics. Once again, lowering the chance of injection site lesions, antibiotic residues in beef, everything starts to play together. So as we get those cattle through the production chain, whether it be cows, calves, fed cattle, the way we handle them from birth to harvest impacts the quality of the beef we produce.
It
must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones, all they want to do is go to the barn, swing a rope, and be a cowboy. It's something, it's a lifestyle that we have, the way we make a living, obviously, but it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and Norbrook delivers. Introducing new NRoblox 100, the newest addition to your arsenal for treating bovine respiratory disease. NRoblox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about NRoblox 100, the new choice. This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to Doc Talk. Dr. Dan Thompson here with my friend and colleague, Dr. Mike Apley, and we teach and work and do research at the College of Veterinary Medicine at Kansas State University, where Mike is the Frick Professor and is a boarded clinical pharmacologist besides being a veterinarian. Let's talk about, because I know you want to get into this, about giving these injections properly.
Yeah, so on the label there's a regimen, which includes the dose, how much you give per 100 pounds, the route, subcutaneous under the skin, intramuscular. We prefer the subcutaneous under the skin, sub-Q, and duration, so how often you give it, for how long, and frequency. So those two to go together for how often, for how long. One of the things I've seen that concerns me is some attitudes about where you can give these things. And of course, beef quality assurance is something that anyone who works with cattle and anyone who works with pigs should be pork quality assurance trained and certified. I mean, there are two great programs. But there's one drug out there that's labeled for giving at the base of the ear, and that's Exceed.
Yep.
And it's a good antibiotic, one of many good antibiotics out there. But people have started taking shortcuts and putting that under the skin and the neck. And there's just no real reason to do that other than not wanting to do it properly and restrain them and get them around and get to the base of the ear. And the thing that everyone needs to understand is if they do that, we're not sure what happens to efficacy, how well it works. But we know one thing, that the slaughter withdrawal time is drastically extended above what it is at the base of the ear.
Because they're putting it next to the edible tissue.
Yeah. And so they need to have a real discussion with their veterinarian. And if their veterinarian is recommending that, they need to have a discussion with the veterinarian who isn't about why they're not. Because it's a residue issue, it's a legality issue, because for that drug, any use other than specified on the label, as far as where it's given and how much it's given, is illegal. So not only is that a bad idea for residues, it's also an illegal act to do that, and we don't need that in the cattle industry.
Well, and that's one of those drugs that is critically important to human medicine as well. So if we want to keep these tools and we want to keep using these tools, we'll use them appropriately.
Yeah, and we have to. And transparency is increasing, and we need to understand that everything we do with our animals is open to scrutiny, and we want to be doing those things right. So that's one of the things that bothers me out there, and I think we could do a lot better.
Cool. Well, thanks for being on the show today. Appreciate you
bet.
Taking the time. Folks, beef quality assurance, proper antimicrobial usage. All these are important things that we need to do to keep the tools around so we can keep our animals healthy and keep a food supply safe. Work with your local veterinarian, and if you would like to know more about what Dr. Apley and I do here at the Veterinary College, you can find us on the web at www.vet.ksu.edu. Thanks for watching DocTalk today. I'm Dr. Dan Thompson, signing off from Kansas State University's College of Veterinary Medicine, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.